cracking up over here. You do that with comedians. All right. Our furry friends are recovering from a stressful weekend. So many of them, including my pup, were spooked by those Independence Day fireworks.
But those nerve-wracking nights may not be over because summer storms can also send Fido running for cover.
Oh, poor babies. All right, here to give us some tips on how to deal with canine anxiety, Dr. Eric. Now, Eric, I have to say, is it Ruhland?
Ruhland, you got
Thank
it.
you. I'm very, like one of my only jobs is to get someone's name right, and so I always think I'm going to get it wrong. Does that make sense?
Everybody calls me Dr. Eric because I don't want them to have to navigate
God.
I'm just going to call you Dr. Eric.
All right, he's from the St. Paul
My
Pet
staff calls me
Hospital.
worse at times. So.
Oh, that's, me too, all my staff here, right?
Yeah.
Oh, yeah, you
No,
have a
my
huge staff.
Okay.
Huge staff.
Now, so these meltdowns that dogs have, I know our pup, Harvey, I've talked to you off air about her. She can get really anxious, especially during thunderstorms and stuff. How many dogs go through this? Is this a kind of common thing?
Super common. I would say close to 25 to 30% of the dogs in our practice, and just in general, that we see that have it. And it's great that we're talking about it now because a lot of times we can talk about it before the 4th of July. And some people that have a recent dog, like most people aren't really thinking about it, and then afterwards they're like, oh my gosh, like last weekend was so awful.
Our dog Junior is practically still is bedridden from from the fireworks and the storms. Like he just gets so upset and starts shaking the minute it happens, and So
no, it's great that we're talking about it now, like I said, and everybody seems to be talking about like what happened last week. So anyway, But.
And we brought this up, but these Thunder shirts, they've got these products out there now. How do those work? And does that help?
Absolutely.
I'm wearing one right now.
It's like
it's keeping me calm during this nerve-wracking television experience. So, yeah.
It's like swaddling a baby. It's a pressure thing.
But I mean, if I feel anxiety in a minute, would you want to just maybe hug me tightly,
Absolutely.
Dr. Eric?
Anybody would want to be like.
I just want you to be on the
coddled.
ready because I feel like I'm getting a little nervous, and I just feel like if Dr. Eric would like to swaddle me, I would like that.
Okay
anxiety would be better. No, they work great, and they have to be fitted, and they wrap them and swaddle them, and it's a pressure thing. And once the pressure is relieved,
makes them feel safe.
They totally. Temple Grandin, actually, who everybody is aware of Temple, they use pressure. She actually uses
for
pressure.
Autism. It was for autism.
Yeah, and they use it for some anxiety and nervous conditions. So it does work in some cases, and some patients I have, it doesn't work very well at all.
Okay.
So.
We have found we have a little winter coat for our dog Harvey, and she actually, so if you don't have a Thunder shirt, it actually really does help her too.
Absolutely.
Just feeling like a fake enclosure.
Yeah.
I know sometimes I just like to crawl under the bed too and just like wrap myself in a blanket and not answer the phone.
So
but that's not about thunderstorms. That's just like Wednesday. So
So the important thing to remember is when a thunderstorm is happening and when this is coming up, it's important to have access. First, it's important to recognize the condition and know that your dog is going to have that, but it's important to have a space or have an area that the dog can go. And it has to be available all the time, and it has to be, I like to have a brightly lit room, either in the basement or someplace away from the noise, and it's very brightly lit. No external light can come in, and the lights are on full volume, and blankets over the top of the kennel so they can get there, and that place has to be accessible all the time. It has to always be available to them.
Always open.
Yep.
Okay.
Yep.
And what kind of causes this for dogs? I mean, it's not just the loud noises.
It's that.
Yeah.
Is it really?
Well, it's a training and a sensitization that happens over time, and it usually doesn't happen after one stimulus or one event. It's a progressive phobic.
I want you to stay forever, and if you need a ride home, I'm here.
Yes.
But I have a quick question. So we have a new English setter. She's a little bit over a year, and we just found out she has some sort of genetic born with kidney disease.
Renal dysplasia. Likely, that's what it is. Yes.
And so we took her in. They said the kidneys look great, but we put on a low protein kidney health food. Now, is she going to be okay?
She should be fine. Like we were just saying before the break, you only need 25% of your kidneys to function.
Oh.
So, yeah.
We should Airbnb ours out.
Yeah,
that's right.
Make some money.
Yeah, that's why we can donate. That's why you can donate your kidneys.
So just make sure that she eats, because the protein is what's hard to digest.
Exactly. It's hard for your body to remove ammonia, the byproduct of protein degradation, which people don't know this on really high protein diets. You can fry your kidneys because you have to get rid of that ammonia. The ammonia, when you smell pee, that's the ammonia that's in that. Okay. You have to get rid of the urea that you're producing when you break down those products.
So should we get a second opinion as well? Do you think?
Absolutely. I
will be over later.
All right, sounds good.
With a bottle of Pinot Noir.
And what I'll remind everybody when it comes to storm phobia is really talk to your veterinarian about particular drug protocols for each and every dog is very different. So sometimes we will use Valium, we can use alprazolam, we can use trazodone. There's different drugs for the way different dogs present, and your veterinarian is going to know a much better way. Once they meet and understand your dog, they will know a better approach to each.
And so what you're saying is the same one doesn't work for every dog.
It doesn't necessarily. I have some dogs that have ramp-up periods, like alprazolam doesn't work, and it makes them really hyper-excitable, and that doesn't work either. And I suffer from anxiety conditions as well, and alprazolam makes me really anxious, and that does not work well. So,
so talk to your vet. Make a safe space for your dog.
I like the safe space thing. I think
get a safe space. Bright light thunder shirts work really, really well. Removing them from that area, and unfortunately for some of those dogs that are very, very phobic, especially with fireworks, drugs work amazing. We have drugs that work. And talk to your doctor about those.
Thank you.
Right. Dr. Eric Ruhland, thank you so much for joining us. And if you want more information, just head to stpaulpet.com.